Hi, I'm attorney Rachel Cheek, and today I want to talk with you about prostate cancer and how it's rated. Most importantly, how it's rated after it's no longer active. So, just as a disclaimer up front, I want to say I'm going to be using the term prostate cancer throughout this video. It's the most common type of cancer of this kind that I see with veterans, and the situation that I'm talking about is something that I see probably at least once a month from different clients who have this condition. But I want you to be aware that throughout this video, even though I'm saying prostate cancer, these rules apply to all cancers of the genitourinary system. So that also includes things like bladder cancer or kidney cancer, anything that affects your ability to urinate. Um, that's what we're talking about here, those types of cancers. So just keep that in mind. So cancers of all types are going to be rated 100% while they're active and while you're actively receiving treatment for them, whether that be radiation, medication, chemotherapy, surgery. Your cancer is going to be rated 100% while it's active. Prostate cancer in particular is a condition that's very responsive to surgery. So I see that a lot. Some veterans will have prostate cancer, have it be active, they have surgery, it works, it's effective, they no longer have prostate cancer actively. So what happens if your cancer is either treated through radiation, chemo, or surgery and you don't have it anymore, or it's not considered to be active? You might be in watchful waiting, is what they call it, remission where nothing's active right now. When that happens, this is very specific to genitourinary cancers. The VA's requirements specifically, like this is required. VA is not just doing it for fun. They're required to in the regulations for ratings for these types of cancers. 6 months after your last treatment or your surgery or radiation, the VA is required to reevaluate you. And you're going to have a CMP exam for this cancer. Now, if it's still active and you're still actively receiving treatment for it, your 100% rating is going to continue. I'm not a doctor. Maybe someone, did the treatment. 6 months later, they find that, okay, actually, we need to do a treatment again. So a situation like that, your 100% rating is going to continue. So there's no worry that if you're like, okay, I still have this, why am I being evaluated? VA is required to do it 6 months after the last treatment. So what happens if you're in a situation where you're 6 months from your last treatment, you're going to that required CMP examination, and you don't have active cancer anymore? Thank goodness that treatment worked, and you're in remission, watchful waiting. So if the cancer is no longer active and the CMP exam or the examiner finds that, there has been no recurrence, there's been no metastasis, VA is required to reduce that 100% rating you have for your cancer being active. Again, this is actually VA not being capricious. They are really required to do this. So VA, in being required to reduce the 100% active rating, they then are required to rate your cancer residuals. So even though the cancer is not active, what symptoms do you have remaining from it? Well, for these types of cancers in particular, VA requires that rating to be based on either voiding dysfunction, so it's urinary dysfunction, and that can be either leakage or frequency, whichever of those more fits your condition, you're going to be rated under that. Or, and we see this with like kidney cancer, for example, renal dysfunction, kidney problems. So again, voiding dysfunction or renal dysfunction is what they're going to rate your prostate or genitourinary cancer after it's no longer active. And they're required, you might have both, and they're required to rate you under which is most prominent. So which causes you the most problems. Maybe your labs for your kidneys are a little below average, below where they should be. They're not terrible. You might get a 0% rating, but you're having a lot of problems with urinary frequency or incontinence, having accidents, then you would be rated under the urinary problems, whatever's causing you the most impairment in your everyday life. So what happens when your cancer is determined to no longer be active and you get that letter from VA that proposes to reduce your 100% rating? First, don't panic. They are actually correct in, they do have to stop that 100% rating. However, they also should propose a new rating. And that's going to be based, like I just spoke about, on your residuals. A lot of times this proposed rating is comically low. They're going to try to take you from 100% to a 20%, and maybe you should be more at like a 60%. But the first thing to do is to just know that that's okay. For VA sending that letter is par for the course. And then I would encourage you to know what your rating should be based on what your symptoms are. If you're interested in hearing more about that, you have voiding dysfunction, or you have voiding dysfunction and not related to prostate cancer, and you're just watching this video for fun, I'm actually going to talk more about that in depth in a separate video, so keep watching. For everyone else, thank you so much for watching this video and subscribing to Hill and Ponton's YouTube channel. I'm attorney Rachel Cheek.